Well, hi everyone. Today we're gonna answer a question that was asked on social media about peripheral neuropathy. Alex wanted to know more about it. What are the symptoms of neuropathy and what can we do to treat it? Neuropathy is quite common. The most common reason for neuropathy that we see in our offices here at Angels is diabetic neuropathy, although we sometimes see it in patients who had extensive alcohol intake in their history. The usual symptoms of neuropathy are sensory loss. It is often in the toes or the distal parts of their extremities, and then progresses towards the proximal parts, towards the knees. The sensory loss is usually asymmetric sensory loss. In other words, it tends to involve both feet or both toes on both sides, and then progresses towards the knees. Later on, your doctor may notice that there is some loss of reflexes in the lower extremities as well. This is the kind of thing that only your physician can notice. And when the neuropathy extends, you can also notice that it's involving your hands as well in later stages. And in advanced cases of neuropathy, you may even feel some weakness in the feet. You may notice that you're unable to walk on your heels, or that your feet are dragging or catching the edges of the carpets when you're walking. That is an important sign to detect when you are visiting your doctor. They often have you walk on your heels or toes to see how strong you are in the lower extremities. So if you are suspected of having neuropathy, the first question will be what is causing it, how can we confirm it. A common test that is done nowadays is nerve conduction studies and electromyography. The test is called EMG, and it is done at the neurologist's office. If you are confirmed to have neuropathy, often we will do a fasting glucose test to check the level of your glucose in the morning before you eat anything, or we can do a glucose tolerance test, or we check a certain blood test called the hemoglobin A1C. It is the most common test done nowadays to check for diabetes. If you are confirmed to have elevated sugars or elevated hemoglobin A1C, then your primary care doctor will most likely advise you to have some lifestyle changes and to control your glucose, sometimes with certain medications. So controlling the glucose, if it is elevated, would be probably the mainstay of your treatment of your neuropathy to prevent it from getting worse. But also there are certain medications that one can use to help with the symptoms of neuropathy, mainly if you are having too much burning or too much sensation. The neuropathic medications that we can put you on, such as gabapentin or similar agents, could be helpful in terms of lowering the amount of pain that you're having. And lastly, we don't want to forget about diabetic foot care. That is pertinent in this case because many patients have sensory loss in their feet. They are often unable to recognize certain harmful objects in their shoes, such as a pebble or small nail, and they can actually break the skin. So it's important to have their feet constantly covered by stockings and to inspect their shoes before they wear them, and not to walk barefooted in their house. I hope this is helpful. If you needed any other questions answered from me, just follow our professional page on Facebook or on Twitter, and you can send your questions and I'll be happy to answer them on our YouTube channel. Thank you.